that position. Out of all of the major bills that have come through our committee, I'm whining now. Sorry, I should get back on track. You know how many Republican amendments have 1, 2? And they were very generic, like, let's look to see if there's a cheaper way to do it. And that was.
But all that passed us. You know, now.
I'm willing to do that. I'm willing to do that. So, yes, sir.
Lee, you know, I came to your Bellevue town hall today too, and there was an interesting question by a guy in the audience, and I just want to ask you because I'm not sure that we got expanded on this enough. And it was, I thought it was brilliant that this guy brought it up. It was the idea that, and it would have to be self-imposed by the Congress, but that why not use the Constitution as your baseline for whether or not anything that can pass as legislation. In other words, you need to have a constitution as the authority for any legislation that pass. And when he said that, I thought, my God, what a great original idea. It may not be an original idea, but it is what our founders had intended. And so, there's probably difficult to implement, but as a philosophy, I would ask that you could push that specific thing, because if we aren't governed by that document, and right now we're runaway, in my opinion, our government officials are just runaway. I'm wasting too much time. I apologize. You understand the question?
I get that question a lot, and I think it's a fair. Yeah, I do.
First time I heard it, so I was really.
No, and I think a discussion about the values and the principles that are in the Constitution of trying to have a limited federal government, although the issue of how strong that will be has been with us since Washington. And in fact, the Jefferson-Adams election was all based on that. Jefferson called Adams a federalist, that he wanted more federal power there, and beat him. But I think it's healthy now as we're dealing with a series of bills that increase the power or centralizes more power away from states into Washington, D.C. And another just kind of an academic discussion here too is it's all being centralized within the executive branch now. Exactly. And so I think we should have a healthy national discussion about our values. Is that what our Constitution was built upon? You got to, any law school professor is going to tell you you have to read the Supreme Court decisions to make a legal opinion about whether or not it's constitutional or not. But I think it's healthy to have a discussion. And while we have discussions about whether or not to federalize health care or bring the federal government more into health care, I think the other side of that argument, sir, is equally as appropriate to discuss.
Former President Reagan hit it on the head when he said, government doesn't solve problems, it just subsidizes them. And this healthcare system that you have as a federal employee, does that have a penalty if you don't sign up to put you in jail or have an income tax penalty?
To do it on health care?
Yeah, okay. You mentioned that you're involved in the healthcare as a federal employee?
Yes.
Okay. Does that have a penalty section in there? That if you don't sign up, you go to jail?
No.
Or you pay an income tax penalty?
No.
Okay. Well, I'll tell you what, everything that I've read in the Wall Street Journal, the Forbes, the Economist, they say if the government gets involved, the cost of your insurance premium will go up because you've got more bureaucracies. You see, it's subsidized.
113 yes.
And the other thing too is like, for the past couple of years now, the Democrats have had a veto majority in both houses, yet there's nothing getting done. So gridlock is good when it comes to, gridlock is good.
It's all, from your different perspectives are relative.
And the other thing is, why isn't there a private sector solution, an industry solution to this alleged healthcare problem?
Well, I think there is.
Yeah, why does the government feel the need to get involved and tax you to death?
Do you want to respond to that?
They want a mandated health insurance policy through insurance companies. And that's exactly it. That's the total of it.
And that's the level, and that's what we hear back. Yes, ma'am.
I know with the atmosphere in the room, this might be a little controversial, but with the recent
This is democratic. This
It's like
is what America's about, isn't it?